Hi everyone, how are you? Welcome to another question and answer session. This is physiology question of MRCS. The question: which of the following surgical procedure will have the greatest long-term impact on a patient of calcium metabolism? So we have to find out the surgical procedure which causes impaction or which causes long-term bad effect on calcium metabolism. Here the options are distal gastrectomy, cholecystectomy, extensive small bowel resection, subtotal colectomy, and gastric banding for obesity. So we have to find out one of the surgical option following which the calcium metabolism will be hampered and calcium reabsorption will be reduced. So for this we have to find out the normal absorption pathway or normal absorption process or site of absorption of the calcium. So let's see, calcium is mainly reabsorbed or absorbed from the small bowel. So this point is important. The calcium, it is mainly absorbed from the small bowel, that means the duodenum, jejunum, and ileum. And the second one, here we can see the bowel resection direct long-term impact on calcium metabolism and increase risk of osteoporosis. A small bowel, that means the duodenum, jejunum, and ileum, they have direct impact on calcium metabolism and they produces the symptom due to lack of the blood calcium level. Here only 10% of the calcium is absorbed from the colon, that means in the large intestine only 10% of the calcium reabsorbed, and that's for this subtotal colectomy will only have a negligible effect. So if we remove the whole colon, it will produce little effect, that means no effect, because about 90% is reabsorbed from the small bowel. So if we remove the large bowel, it will impact very less, but if we remove or cut the small bowel, it will impact on calcium metabolism because it absorbs about 90% of the calcium. So here we can see a slide on calcium absorption. It occurs mainly transcellular and paracellular also. So transcellular and paracellular route calcium is reabsorbed. Function of calcium content of chyme, most absorption occurs in the ileum, which is part of the small intestine. 125 dihydroxycholecalciferol, it stimulates synthesis of calbindin in the gut cell, which increases the calcium absorption. And here we can see calcium absorption. Calcium is absorbed by active transport mechanism in the small intestine, and among them most of them into the ileum. Here we can see these are in the ileum. So it is now our answer ready. It is one of the easy question now. There's the calcium metabolism. It main reabsorption occur at the level of the small intestine. So if we cut or surgically remove the small bowel, there will be impact on the calcium metabolism. Other options such as here we can see the distal gastrectomy. Usually the gastric, that means the stomach, it usually not absorb the calcium. Then cholecystectomy, it has no role on calcium metabolism. Subtotal colectomy, it reduces absorption only 10%, which is negligible. Gastric banding for obesity, it is also not true because stomach is not related directly to the calcium metabolism. So our answer is a small bowel resection. Following a small bowel resection, there will be decreased calcium metabolism because the calcium is absorbed in the small intestine, mainly in the ileum. Thank you all.